Dr. Christopher Barker, and welcome to Holding Space. I am going to try to answer a question that someone left um, on one of my other videos. And because I love the comments, and please keep making them. Please keep sharing. You can email if you don't want to leave a comment, but like, subscribe, and let me know what you're thinking about some of these topics. And you give me ideas for other things to talk about. Anything that you find particularly interesting or you want to hear more about. I've been a psychologist for over 20 years, and I have been doing this in a couple of different states, and I've worked with a variety of populations, so I don't pretend to be an expert on everything, but I'm glad to share my expertise on what I do know. One of the questions that I got is, what's the difference between bipolar disorder and borderline personality disorder, or BPD as it is often called these days? There are quite a few differences. There are also some similarities, and it's really an actually much bigger question than it seems. So I'm going to try and run down some of the basics, and hopefully it may lead to some other discussions, and maybe we can do more on this in the future. Okay, so when you look at bipolar disorder, which I was talking about at the time as being something that's more of a spectrum disorder, because there are several stops along the way when it comes to being bipolar. There's childhood onset bipolar, there's type 1 bipolar, there's type 2 bipolar, and probably there's some other things in between. I think probably without going back over all that material again, I think probably the diagnosis that's closest to borderline personality is type 2 bipolar. Now, keep in mind that bipolar disorder is a medical disorder. It is like diabetes. There is medication for it. There is treatment for it. It's a serious disorder. As such, in the Diagnostic and Statistical Manual of Mental Disorders, number 5, TR, we are into at this point. It's part of an Axis 1 diagnosis, which means that it can be a primary diagnosis as far as insurance companies go, hospitals, that sort of things. But it's kind of like more important. It's one of those things that is seen as being a primary disorder. So, diagnostic criteria for type 2 bipolar includes at least one hypomanic episode. I'll explain what that is in a minute. At least one major depressive episode, which is a period of several weeks of depressed mood, decreased functioning, and no history of manic episodes. Now, hypomanic episodes you can have, and that is a distinct period of elevated, expansive, or irritable mood and increased activity or energy lasting 4 consecutive days. Now, I know when I was presenting it, I was talking about how the spikes can come with type 2 bipolar, and you can see that. Usually, it doesn't come as a result of being in the baseline. The person is becoming slightly elevated in terms of their energy level, and then it can spike into rage, it can spike into euphoria, exaggerated symptoms of that type. During that period, 3 or more of the following symptoms are seen: inflated self-esteem or grandiosity, decreased need for sleep, so you could feel rested after only 3 hours or 2 hours or none at all, more talkative than usual or pressure to keep talking. We referred to pressured speech, which is the person is talking so fast that you feel the pressure of the speech coming out at you. Flight of ideas or racing thoughts, distractibility, increase in goal-directed activity, or psychomotor agitation. They're pacing constantly, or they're putting out a lot of podcasts, that sort of thing. Excessive involvement in risky activities, spending sprees, sexual indiscretions. Usually those are the main two in which you see that sort of behavior. The episode must be observable by others, and it must not be severe enough to cause marked impairment or require hospitalization, and it's not attributable to substance abuse or some other type of disorder. That is type 2 bipolar disorder. And that is, as you can see when we talk about borderline personality disorder, there's some similarities in distractibility and in energy level and in relationships to other people. But borderline personality disorder is a totally different animal. It is a Axis 2 diagnosis, which means it is a personality disorder. Psychologist Gregory Lester, who was one of the people who came up with the classification of personality disorders in the diagnostic and statistical manuals said that a mental disease or a serious disorder, a neurosis, bipolar disorder, is like catching a cold, or it's like catching the flu. There's something you can do for it. There's treatment. You can live with it or get over it. Cures, I don't know, but you can definitely treat it. A personality disorder is a disorder of your personality, your whole person. It is pervasive. It is hard to nail down. It is subtle sometimes. He said that it's more like the difference between opening the hood of a car and saying, oh, there's something wrong with the carburetor, and opening the hood of a car and saying, there's no engine. There's so much that can be involved in your personality that it's really difficult to isolate it to one thing. So the diagnostic criteria for borderline personality disorder are frantic efforts to avoid real or imagined abandonment. This includes extreme reactions to perceived abandonment, whether real or imagined. I think my girlfriend's going to leave me. I'm going to do something to get her attention. And whether she is or whether she isn't, you're just having a lonely moment, it can feel like that sort of real abandonment is coming. They're just absolutely certain. Unstable and intense interpersonal relationships. This is sometimes characterized by what they call splitting. A person can be either the greatest thing since sliced bread or the biggest piece of crap in the world, sometimes within a single minute. And it depends on what's going on and how you're receiving it. And your emotional stability is so up and down that it depends a lot on the feedback of other people. And if they are giving you what you need at the time, then they're great. It's terrific. It's a great relationship. It's wonderful. Everything's perfect. And then as soon as they let you down, the whole thing is just trash. You see that very frequently with people with borderline personality disorder, but you can also see that, and this is an important point, with other types of relationships and also with other types of disorders. Any one of these things by itself does not mean that you have a particular disorder. More on that in a minute. Identity disturbance. Markedly and persistently unstable self-image or sense of self. You feel like somebody else. You're not sure who you are. You're not sure what you believe in or what you need, and a lot of people will sort of take on new roles or new personas even sometimes. Sometimes people with borderline personality disorder feel like they have multiple personalities. They do not, but they may have multiple personas and they may be at conflict with each other. Sometimes you're feeling like this person and sometimes you're feeling like your mother and sometimes you're feeling like your father and sometimes you don't know who the heck you are. But it is hard to get a general guideline of who you are today. I don't know if any of you have ever felt that in passing, because again, this is another one of those things that can be something that can be experienced with autism spectrum disorder. It can be something that can be experienced when you're having an existential crisis at work in a personal relationship. That is something that, again, can happen to normal people. And what does normal mean? I have to do a whole show on that at some point. Normal is basically a statistical entity. The majority of the people do this, so therefore it's normal. Is it healthy? I don't know. And that's another story. Like I said, we'll talk about that another time. Impulsivity. Engaging in at least two areas that are potentially self-damaging, such as spending, sex, substance abuse, reckless driving, or binge drinking or eating. This is unlike one of the symptoms of bipolar II in the sense of that hypomanic phase in which you're starting to escalate. You can indulge too much in something, but it's again part of these other symptoms and not necessarily observable with the bipolar symptoms. Recurrent suicidal behavior or self-harming. This includes threats, gestures, or self-mutilation. This should be a whole episode in and of itself, because self-harm is one of the things that is almost a sure sign of borderline personality disorder, but it's also something that people can come to in times of desperation. Self-harm is the best way I've ever heard it put is pain you can control. So when you're feeling like things are out of control in your life, you resort to this particular method of controlling pain. And again, trigger warning here, skip over this next part if these things make you queasy, but people can cut on themselves. People can get many tattoos, believe it or not. That is one socially acceptable way of self-mutilation. And some people tattoo themselves with needles and indelible ink. I knew one woman who used to take a needle and sew on herself as though she was pulling thread through a wound. There were no wounds and there was no thread, but she did have the needle and she would pull it through. Sorry to describe that so graphically, but that is one example of how diverse self-harming can be. And you can scratch yourself with your nails. I know one woman who has to keep her nails short because she knows she has a tendency to, when she's desperate, to scratch herself or clench her fist so badly that she cuts into herself. And again, it's the stimulation. It makes you feel a little better because it releases beta endorphins, but it does not solve your problems. Let me go on. Again, that should probably be a whole episode by itself. Affective instability, marked reactivity of mood, such as intense episodes of dysphoria, irritability, or anxiety, lasting a few hours to a few days. And here again, this is very much like bipolar II, but it's not quite the same thing because it goes with these other things. And again, this can be if you're feeling abandoned or if you're feeling like you're going to be abandoned, you can be explosive, you can be angry, you can be upset. And this can go on anywhere from a few minutes to a few days. Chronic feelings of emptiness, a pervasive sense of emptiness or boredom. It's been said that people with borderline personality disorder don't feel like they exist unless they have someone there to reflect them. And if you have a relationship with somebody and they are giving you some feedback onto who you are, how you are, they're making you feel good or they're making you feel bad, then there's that unstable sense of self that we were talking about before. That unstable sense of self. You can feel it's not necessarily just emptiness or boredom. You can also feel desperate for contact with other people. And sometimes people will call you out of the blue and pick a fight because they just need stimulation. Whenever people do something that seems totally unpredictable, you have to stop and ask yourself, why? What's going on with this person? Inappropriate, intense anger, difficulty controlling a lot of emotions, but also anger, leading to frequent displays of temper or physical fights. And again, that's something that you can see with bipolar II. Transient stress-related paranoid ideation or severe dissociative symptoms. These may occur during times of stress. I am going to do something separate on dissociation also, but paranoid ideation, you don't like me. You're out to get me. And again, more from that feeling of abandonment than it is from a true sense of paranoia that you get with schizophrenia. Severe dissociative symptoms. Anxiety is because all the emotions are running high with this personality disorder. You can dissociate or feel like things are unreal. The people around me are strange. Everything looks odd. I don't feel like I'm in my body anymore. And again, that kind of goes with the identity disturbance and that goes along with the elevated emotions. I know I'm throwing a lot at you here, but again, let me know about more things that you want to work on. I've already mentioned 3 or 4 additional episodes that we can do on the basis of this. You must have at least 5 of these symptoms, which must be present in various contexts and typically begin in early adulthood. I'm going to say something controversial here. I mean, that you technically can't be diagnosed formally with borderline personality disorder before the age of 14, 16, but I have seen it in children as young as 8 or 10. And again, personality is something that is still forming. And I think the reason it's diagnosed only in more adult people is that your personality isn't really fixed until that age. It's characterized by a pervasive pattern of instability in interpersonal relationships, self-image, and emotions. That is, believe it or not, the short answer to that question. And again, there are a lot of these symptoms that are going to require their own separate episode, and we will be holding space for those. But I hope that gives you some idea of the difference. Sometimes it's subtle, and the two things can exist side by side. You can have both. You can have a personality disorder and you can have a bipolar disorder. So, I mean, and some people do struggle with these, and it is a real struggle. I'm not by any means making light of any of this. It's very difficult. But again, it is treatable, and we can talk some about the treatment for borderline personality disorder, which is difficult to treat, but not impossible. And some of the extreme topics under this include what happens in therapy, why doesn't therapy work, why do some therapists not want to work with these personality disorders. But again, tantalizingly, I will tell you those are for a future episode. For now, hit like, subscribe, leave your comments, questions, remarks, and also there's an email you can write to if you have private questions. Always feel free to address me and let me know what you do. I try to answer most comments in a timely fashion. So let me know how you're feeling, and thank you for holding space for me today.